But the UN Secretary General also set up an independent think tank called the Sustainable Development Solutions Network, which brought in people from multiple sectors and set up 12 thematic groups addressing different areas of development, health being one of them. And these thematic groups not only developed recommendations based on a detailed review of the current scenario and the projections, which as relevant to sustainable development in each of the areas, whether it's education, health, poverty, environment, gender, and so on. And also connected among themselves to see how these variety of development domains were closely interconnected and were influencing each other, and how the ultimate template of sustainable development would not only accommodate all of these domains in a mutually supportive manner, but would be synergistic in terms of helping each other to do much better. So this effort led to a series of recommendations, both on the nature of the goals and the targets, but also on some of the suggested indicators. And these were ultimately transmitted to the UN Secretary General's office and fed into the process of the document that the open working groups prepared and the Secretary General's consolidated report, which ultimately went to the governments for their intergovernmental negotiations. So in terms of the initial major draft that the governments looked at, I believe we have had substantive inputs. The MDGs were helpful in some ways in bringing health very prominently into the global development discourse. The fact that 3 of these 8 MDGs related directly to health and some others had an indirect relationship to health was an important feature. However, the MDGs were principally directed at low and middle income countries. While that did help to generate some support and resources from the high income countries, there was a disconnect, there was no global consensus, or there was no universality to the nature of these goals. More importantly, they segmented health by age and fragmented it by disease. You had mother and child, but you didn't have adolescents, you did not have the adults and the elderly, you did not have the males, and also you had disease-specific programs looking at HIV, AIDS, malaria, and tuberculosis. Many others were left out. This had a deleterious effect on the health systems of low and middle income countries, which, being under-resourced, were now being pushed into vertical programs which had an opportunity cost for everything else in health. And secondly, it also brought in a certain distortion by measuring only mortality. Morbidity was not measured, and the indicators were aggregate national indicators. They did not really look at inequalities within countries across various social classes or within geographic regions. So you could achieve an improvement in your aggregate national indicator, but still have widening gaps of health equity between the social classes within a country. So there were several of these issues that came up with the MDGs, and of course they were totally disconnected from other domains of development, the social determinants of health. So all of these needed to be corrected among the SDGs, and to a large extent the SDGs have done that. They've brought in a much more embracing concept of the life course into the very health goal by talking about healthy lives for all and well-being at all ages, and also trying to bring together multiple disease-specific as well as age-specific areas into the targets that are linked to the health goal, but not necessarily separating them out. But most importantly, it places health very centrally in the framework of sustainable development, closely linked to other development domains, to the extent that ultimately when you look at the various targets under each of these goals, they support health in one way or the other. So I would believe that health is the best summative indicator of success across all of SDGs. If the health improves as per the stated health goal, that means we have really achieved success in the other goals as well. I believe it is absolutely important for the government at the highest level to bring together all the sectors and say, how can we actually work together towards the achievement of these goals, so that policies and programs in each of the sectors will enable and not erode the goals in the other sectors. We are all in it together, and whether it's environment or whether it's gender or whether it is peace and conflict avoidance, we are all in it together. And so also for health. I mean, there are huge health inequities even in the high-income countries. So we really need to share knowledge, but also be inspired by the common goals. There has been a substantial mention of inequality as one of the fundamental causes of poor health in societies. And even high-income countries do experience ill health in several groups within their populations because of uncorrected inequalities. I think the important element is to knit together the social determinants of health as well as the better outreach of high-quality health services which are affordable.